Guided meditation, coronary arteries of the heart. Close your eyes. Take a slow, deep breath in. Feel your heartbeat. Tonight, I am not studying anatomy. Tonight, I become a tiny drop of blood entering my own heart. I stand inside the ascending aorta. Just above the aortic valve, I see two beautiful doors. These are the coronary arteries. As the heart relaxes during diastole, both doors open and I gently flow inside. The heart nourishes itself only when it rests. The left coronary artery is larger because it supplies more myocardium. The coronary arteries are functional end arteries. Although tiny connections exist, they usually cannot compensate if one artery suddenly becomes blocked. I remember. The heart rests, then feeds itself. The right coronary artery. I enter the right coronary artery. I arise from the anterior aortic sinus. I travel forwards, towards the right, between the pulmonary trunk and the right auricle. Then I enter the right atrioventricular groove. I continue around the inferior border of the heart, onto the diaphragmatic surface, then backwards in the posterior coronary sulcus, until I reach the peaceful crux of the heart. As I travel, I give life. First, I send atrial branches. One special branch becomes the SA nodal artery. In 60% of hearts, it comes from me. In 40%, it comes from the circumflex artery. Next, I give the right conus artery. Together with the left conus artery, I form the beautiful annulus effusions around the pulmonary trunk. Then come my anterior ventricular branches, posterior ventricular branches, bringing oxygen to the right ventricle. Along the sharp border of the heart, I send the right marginal artery, walking quietly toward the apex. Near the crux, I create my most important branch, the posterior interventricular artery. It descends through the posterior interventricular groove. It gives septal branches to the posterior 1/3 of the septum, the AV nodal artery in many hearts, and ventricular branches to both ventricles. I nourish the right atrium, most of the right ventricle, a small part of the left ventricle, the posterior 1/3 of the interventricular septum, and most of the conducting system of the heart. The left coronary artery. I return to the aorta. Now I enter the left posterior aortic sinus. This is the left coronary artery. It is larger, stronger, built for the powerful left ventricle. After only a short journey, I divide into two great rivers, the left anterior descending artery and the circumflex artery. The LAD descend through the anterior interventricular groove. Near the apex, I gently curve around the heart, meeting the posterior interventricular artery. As I descend, I send anterior ventricular branches, the large diagonal artery, the left conus artery, and deep septal branches that nourish the anterior 2/3 of the interventricular septum. The circumflex artery. I curve into the left atrioventricular groove. I wrap around the left border of the heart. I continue into the posterior coronary sulcus. Eventually, I meet the right coronary artery. The circle is complete. Along my journey, I send ventricular branches, atrial branches, the SA nodal artery in 40% of hearts, the left marginal artery, sometimes the posterior interventricular artery, and the beautiful Kugel's artery, connecting both atria. I nourish the left atrium, most of the left ventricle, a small part of the right ventricle, the anterior 2/3 of the septum, and part of the left bundle branch. Cardiac dominance. Now I ask myself, who is dominant? Not the larger artery, not the stronger artery. The dominant artery is simply the one that gives the posterior interventricular artery. If the right coronary artery gives it, the heart is right dominant. If the circumflex artery gives it, the heart is left dominant. Anastomoses. I notice tiny bridges joining the two coronary arteries. The annulus of Vucens, Kugel's artery, small septal connections. They remind me that the heart always tries to protect itself. Clinical memory. If cholesterol slowly narrows a coronary artery, blood flow decreases. The heart cries with angina. If blood flow completely stops, part of the myocardium dies. This is myocardial infarction. The artery most commonly blocked is the LAD, then the right coronary artery, then the circumflex artery. I take one final deep breath. I see the ascending aorta, the two coronary arteries, the right coronary artery embracing the right heart, the left coronary artery dividing into the LAD and circumflex, the septum glowing, the SA node beating, the AV node conducting, the myocardium alive. My heart rests. My heart nourishes itself. And with every heartbeat, my knowledge becomes permanent.